This is the Aunty and Brain Tumours talk show. It's a show full of informative chat and inspirational messages. The Aunty and Brain Tumours talk show on podcast.
Hello, my name's Julia, and I have a grade 2 meningioma at the sphenoid wing near the temple of my head. I've had it, I've known about it for about 9 years now, and I also have 2 convexity meningioma on the other side of my head because I'm an overachiever. It all started with feelings of falling down. I felt I was falling straight down as opposed to the left or the right or forward. And I was hanging on to desks at work as I moved about the room and onto bus stops and walls as I was travelling because I was still working right up until being diagnosed. And I saw a neurologist and he eventually got me the MRI. He said, it sounds like we need to MRI your brain. And he put me on to Pyramate for the dizzy spells and the giddiness. I was signed off work in the January and I didn't go back to work until the September of that year, 2016. It was the radiologist who looked at my MRI scan who said, she has proptosis, which means that your eye is coming forward out of its socket. And he said in the results, has she always had proptosis? And my neurologist said then, you've got this. They were not expecting to find this at all. They didn't know what it was. It was quite an incidental finding. But as he looked at my eyes, he said, oh yes, I can see now. So all the time I'd been looking in a mirror up to this point, I hadn't noticed the effect of the brain tumour. The fact my eye was getting bigger and bigger as it pushes forward. I'd completely missed that. In the January of 2016, I finally saw my neurosurgeon in the February or March of that year, and surgery was in the May 2016. At this point, I'm sort of developing depression because one of them had said, we must operate quickly because it will take your eyesight. Well, this wasn't quickly enough for me. It was months and months of waiting still. So I was depressed, off work, staying in bed all morning, not getting up until lunchtime because I felt so bad. Also, I couldn't do anything. And I was mortified at the sound of brain tumour because I still thought of brain tumours in the old-fashioned way and that people were more or less incapacitated, laid in bed, couldn't do anything for themselves. And I was completely wrong, of course, but I never considered having a brain tumour myself or a family member around me. So I was pretty on the back foot as we went towards surgery. It was really, really obvious that I needed something doing, and it just didn't happen quickly enough for me. I was on the phone to the hospital. When's my appointment? When's my appointment? When's my pre-op? When's my pre-op? When's surgery, etc. In that time, your neurosurgeon is consulting with a multidisciplinary team of people over your scans and any talks he's had with you over how you're feeling. So there is a lot going on in the background that you don't see until you actually go into the hospital to have your surgery. It was afterwards they said they didn't get all of it out because I still have it now. I still have both types of meningioma. In my case, they had a maxillofacial surgeon as well because they'd broken all my skull up as well and everything in here. So I think they take it in turns to look at you as they go around the table, but it's also such precise work that it cannot be rushed. And it's not something you want them rushing through at all. For the second surgery, I had something called NeuroLab, which is where they were using cameras and a television screen to look inside my head much more closely, because it's so much further back and in a very delicate position. And I got to have a look at this technology when I was hanging around the hospital and this big monitor screen. In 2020, in the middle of the pandemic, they said, yes, you will have radiotherapy this year and you will have Gamma Knife as well. Gamma Knife was performed on this side of my head for the 2 convexity meningioma. It couldn't be performed on this side of my head because it would have destroyed my optic nerve. They said, can you see out of your right eye? I said, yes, I can. We'll use fractional radiotherapy on this side then, and Gamma Knife on this side. Otherwise, you'll lose your eyesight. And that worked fine. And that's what's allowed me the tumours to be stable, and are still stable now, and have been for such a long space of time, since 2020. My normal monitoring has been yearly ever since everything started to calm down. I had this year's normal monitoring MRI in January. I'm still waiting for the results now. Last year, when I last saw my neurosurgeon, he said the tumours have been so stable for so long that if it's the same next year as in this year, then we will go to 2 yearly MRI scans. So I will skip a year and then be scanned, skip a year and then be scanned. And that's progress. That means that they are confident with how your tumours have been, how the radiotherapy has stabilised them so much. The same with the Gamma Knife, and that's their experience of treatment and how well it's gone. So I'm still waiting to hear this year whether or not we will stay yearly or if I will go on to every other year of scans. I've not heard from my neurosurgeon yet, and I believe that is a good sign because I'm not a priority. I do not consider it a bad experience. I think if they hadn't been able to operate on these tumours, then everything would have been a lot worse. I reckon I've got off lightly, even though I've had 3 surgeries, but I didn't lose my eyesight. I don't have seizures. I've never blacked out. There's an awful lot of positives. It's been very surreal, and that's why I've kept my blog. Regarding Julia, I have a whole folder full of my letters and communications from the hospital that I, for some morbid reason, have kept all this time. It's difficult to explain when you've not been through a similar experience. Yes, it's exacerbated my anxiety. And I think people think I'm some kind of superwoman, but I really am not. I was in a dreadful state before first surgery in 2016. I could not be left like that at all. So I'm very grateful for the surgeries. I had an excellent neurosurgical team in Sheffield, and most importantly, perhaps, the email address for certain secretaries who make bookings on my behalf and also pass messages on to my neurosurgeon and his team of people. Secretaries are invaluable. Being one myself, I know how much hard work it is, but that point of contact is just awesome because you can just fire off an email when you suddenly think of something rather than being held on the phone, waiting to speak to someone for 10, 20 minutes at a time. Even better when they respond and they say, yes, I can help you with that, or I will pass that message on. Really, really grateful for their help. And if you have the same, remember to thank them because they are so busy. And after COVID and being in that environment throughout all of that, they've seen it all as well and still are willing to help you with your journey through bad health. I have a very supportive husband. Very happily, he works from home and has done for the past 20 odd years. So he's there to take me to appointments and basically to prop me up when I need it. Also to sort out my medications after surgery, because certain medications are taken on certain days or for certain lengths of time. So if you have time to plan and discuss decisions with your family or your friends, then do so, because it can help to sort out thoughts that are going around your head. And you can make plans for being in hospital and coming out of hospital, even such things as your sleeping arrangements, because food shopping, for example, things you don't really think about because you do them routinely on a daily basis. I certainly was more or less left to look after myself when I was discharged after each surgery. You just leave the hospital with a big bag of medications. You need to remember when to take them, how to take them, when to have staples removed, when you can wash your hair, when you can't wash your hair. Everything is subject to a very specific routine. And if you are facing surgery now, please bear all of this in mind. And if you're not sure, speak to a neurosurgical nurse or your GP. Your GP's practice nurse should know all of this as well, and it will help you prepare and know what to expect. Make the difficult decisions around having general anaesthetic surgery. You are expected to sign a consent form acknowledging that you are at risk of stroke, infection, seizure, and death. It really does drive things home. So to be prepared for all of these, as well as your friends and your family and your personal administration, really helps. So that is one less thing to think about. Personally signed a will the day before my second craniotomy, and that was then one less thing for my husband to deal with if the worst had happened. Work out how to take your medications. If this is something that you will need to do by yourself, you can buy an organiser, ask your GP or the practice nurse for help organising them. You can get several phone apps which will help to remind you of what to take and when. Get in touch with your chemist. They will also help you as well. Look into support from charities. There are a number of brain tumour charities around the UK now. They are an absolute goldmine for information, of advisors who will help you with decisions and planning, even what to ask your GP or your neurosurgeon before and after your surgery. They can also help with financial problems as well, if need be, and in return you can fundraise for them as well as a thank you. In all of this, set some boundaries and also some goals for yourself and for the people who expect things from you. I personally set myself goals for walking to the end of our street, for the motivation, for the exercise, for something to do. I would take my dog with me so I wasn't on my own. I wouldn't walk too far. If I didn't feel right, I wouldn't go at all. But it was something to aim for as time went on after my surgery. 2 weeks after my last surgery, I was only taking paracetamol for pain relief. That's my personal experience, which has gone very well. If yours does not, do not scrimp on pain relief, because you will feel quite different physically, emotionally. You need to sleep, you need to eat well, you need to have a good amount of fibre in your diet, and you also need to drink water. You need to keep up with all these goals to make sure that your health generally is good while you deal with your brain surgery. Talk to other patients if you find them online, in person, over the telephone. Everyone is going through something differently, but there are common denominators in all of this. We all have to take medication. We all have to take some rest. We all have work to do, probably. Someone will give you their experience and advice on what you can do and what to think about as you recover. You can choose some easy hobbies to do while you are sitting down or lying down while you recover. I personally am a big watcher of TV and films, but I also like to read books, and I'm studying as well at the moment, which will thankfully be over with soon. But it gives me something to do. It gives me an interest, gives me a motivating factor, something to do, something to keep me going, in effect. If you really, really do need support from someone else and you're not getting that, I've heard that some people go through this by themselves, and that is a very big challenge. You may have to cope with public transport because you cannot drive yourself necessarily. Surrender your license to the DVLA and you can instead get a bus pass or a train pass to travel for free because you've had to surrender that driving license. If you have to, use taxis to go to the hospital if public transport is too challenging. But remember, do not drive yourself. It is not worth having an accident or getting into trouble with the police because you shouldn't have been driving. If you know you have a brain tumour, you must declare to the DVLA. Your driving licence is dependent on good health in the brain, the eyes, the heart, and the lungs. Don't get into trouble. It's so easily done when you feel, okay, I can drive. It's really not worth it. If you can maintain a sense of humour, it really does help, and some positivity. It may not seem a laughing matter, and no one is saying it is. It's really not, but humour does pass the time. A positive outlook can help with your recovery, and it can help with your mood and to get out of bed in the morning. I personally had a very weird experience thinking that something under our bed was buzzing, keeping me awake one evening. I'd just had third surgery. I can hear that. I can hear something coming from under the bed. It wasn't anything under the bed. I had tinnitus from my surgery. It was so loud, I was absolutely convinced it was something under the bed, a TV box or something like that. In the middle of the night, I was throwing things around the bedroom. I can't stand this noise. It wasn't that at all. It was me. I was so distracted. It was so loud, so buzzing. And even in hospital, I'd had hallucinations because of the combination of medication and the effect on my eyes. They were also funny, but I've heard that some people can have very scary experience with some hallucinations. So talk to your neurosurgeon or your GP about those if you are experiencing them. Don't suffer in silence on anything at all, particularly not pain and discomfort. You're worth far more than that. And also when you when you're finally told that your MRI scans do not need to be as frequent, you kind of feel pushed out to sea by yourself and rather bereft of support. But the fact is that you don't need that support, maybe physically, but maybe emotionally and mentally, you're not quite ready for it. If I'm told this year that I don't need frequent yearly scans, it's almost disappointing because you think, no, do I not have the support anymore? Yes, I I do have that support, but it's because I've got better. I've got so much better, and I don't need such frequent check-in anymore. Brains Trust, definitely, have been very supportive. I got a brain box in 2016. I've fundraised as a thank you for them. They've actually been, 2 representatives from Brains Trust have been to an event held by the police. That was in October last year that I was at as well. It was about equality and to do with disability and all that kind of thing. Our Equality Hub, which embraces inclusion, accessibility, etc. And I do mention my brain tumour journey at work to my team members, my most immediate colleagues, but on a wider organisational scale, people do not know about it. But I thought, well, who can I invite to this conference who represents me and vice versa? So I did. Yeah, and I've also helped Brain Trust with information about meningiomas and support information, and we've discussed who can also help with fundraising for Brain Trust as well. But there's such a mine of information online. If you go to reputable sources, are very, very helpful. I would say one thing that didn't always happen for me is to be assessed properly by all the departments who should assess you before you leave hospital. So, for example, physiotherapy. Can you stand up? Can you walk? Can you grasp with both hands? Have you got your balance? Can you see properly? How's your head? Are you wobbly? I remember being assessed by physiotherapy. I had to bend down and pick something up off the floor, which I knew I could do, and I just did it without thinking. I would be waiting in hospital for days to be seen by each of the relevant departments before they would discharge me. And sometimes you think, oh, it's not necessary, I'm fine. They would say, oh no, stay in hospital, we must have you assessed properly before we let you out. We need to know you are independent, you can look after yourself, particularly washing your head because of your scar and your staples and the fact that you can't just put normal shampoo on your head, because I don't imagine what that would be like. And yeah, that would not always go right, or it would take days or whatever. So, and nobody ever said at the beginning, oh, well, you will be assessed by before you leave. They would just suddenly appear by my bedside and say, oh, I'm so-and-so from wherever. I've come to see you. And like, oh, okay, who are you? What do you want? And nobody said anything like that. I've just been through brain surgery, for God's sake. I'm not doing a test.
This is the Aunty and Brain Tumours talk show. It's a show full of informative chat and inspirational messages. The Aunty and Brain Tumours talk show on podcast.